Right. Amen. Faith. So there is some background noise, but still we have to be a little stronger. Some marriage or some occasion is going on. We cannot help it. Right. Amen. Faith. Yes.
Okay.
Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon, the trainer with you. Marriage or some occasion is going on. And today we cannot help it. Speaking sessions. This is speaking warm-up session. And the candidate is Amen Faith. She's preparing for nursing profession. Amen Faith. Yes. Occupational English test.
Okay.
Fine, sorry. Hello, Amen.
Hello, sir.
Right. So here we go with the test. These are the daily dosage profession specific speaking materials and the nursing profession specific speaking tasks. Amen. Can you please tell me something about yourself in 3 to 4 sentences?
Yeah, sure, sir. My name is Aman Faith and I am from Gujarat. I have completed my graduation from Bangalore and I'm a cardiac nurse and I'm really interested in my department.
Why did you choose nursing as your profession?
Actually, nursing is a very noble profession, and my mom suggests me because she is a nurse, and I love to serve people, and I love to help people, in the difficult time. And my mom said, "Why not nursing? Because the nursing is a profession you can serve the people as well as you can earn." So because of that, I choose the nursing.
What is your fundamental reason for taking the occupational English test?
The main reason is because I want to work in foreign, in abroad country, and there is a basic requirement that I have to clear the English test. And one of my friends suggested me that occupational English test is nowadays it's a very great opportunity to work. If you clear, then it's a great opportunity to work in abroad. So because of that, I took this test.
Which country is your most favorite destination for migration and work?
Australia is my favorite country for a destination for migration.
Comment on the special qualities of the contemporary nurses.
I'm sorry?
Discuss about the qualities, special qualities of the present generation nurses.
There are lots of qualities we should nowadays in nurses. We have to be sympathetic. We have to be advocate. We have to good communicable and good serve of our services. So there are lots of qualities we have to adopt in nowadays in nursing.
Right. What is the regular routine of an ideal nurse?
It's a very hectic routine because we have to work 12 hours per day and we have to serve the patient, we have to care them, we have to communicate with the doctors, we have to communicate with the attenders, family members, and we have to take care of ourselves as well as we have to follow the rules and regulations. So it's a very hectic, but it's a satisfied job.
Last question is regarding role model. As far as your profession is concerned, who is your role model?
My role model is my mom because she only suggests me to go to do nursing, and I can see how sympathetic she is and how carefully she carry herself and as in her home as well as in her job place. So she is my role model.
Right, that's very nice talking to you. Thank you very much, Amen.
Thank you, sir.
All right. Now we are going to take over with the role play cards. Number 1 and number 2. So first one we'll see number 1. So this is your card, role play card for the nurse is here. Right. Is that clear?
Yes.
And you have the paper with you also, I suppose, right?
Yes, sir.
But you can see here, right?
Yes, sir.
Okay. So are you ready with this role play card?
Yes.
Or do you need some time
Yes.
for this?
No, I am okay, sir.
Yes, I gave you 3 minutes time before itself. So you're ready
Yes,
for
sir.
the speaking.
Yes, sir.
Fine.
Yes, sir. Just I want to know how may I address you, sir, during role play card.
Yes, my name is Abraham Lincoln and you can call me Mr. Lincoln. Is that clear to you
Mr.
or do you need anything else?
No, sir, that's fine.
Right, fine, that's good. So here we are today. Right, this is classical corrections platform and one arm of it, and this is Grandmaster class. We are training nursing professionals and medicine professionals. Okay, so right now we have Eamon Faith with us. This is speaking role play number 1. And Eamon Faith is right now in Baroda, Gujarat, and she is originally from Kannur, Kerala, India. Role play number 1, that is insulin injections. Here is the card. For a second, you can go through this, the audience, for a second. Right. So, Eamon, are you ready?
Yes, sir.
Speaking role play number 1. Diabetes, insulin injections. Yes, you can start, nurse.
All right, sir. Sir, am I just able to see that role play card on screen? That will be really helpful. Yes, sir. Thank you, sir. Shall I start, sir?
Yes, of course.
All right. Hello.
Hello, nurse.
I'm here to talk, Mr. Lincoln. Am I talking to
Yes,
Mr. Lincoln?
you are with me. I am Mr. Lincoln. Come on in. This is my house. Please have your seat.
Nice to meet you, Mr. Lincoln. My name. Hello. Are you able to hear, sir?
Yes, yes, you're audible. Go ahead.
Yes, my name is Amin Faith, and I'm one of the nurses, and I'm here to talk behalf for your, insulin injections. Your GP advised me to come to you and teach you how to take insulins. Are you aware of that?
Nurse, I believe that I have been managing my diabetes well, and I do not want to comment on insulin injections.
Oh, all right, I can understand that. Could you please tell me the reason behind that you are not want to take insulin injection? Is there any particular reason for that?
Yes, I have been managing well with everything and everyone. I have seen many other people also, they are doing well. And I
Okay.
don't see any requirement or need or demand for this. I don't know what is wrong with the doctor. He's asking me to change my
Yeah, I can definitely can understand that. Yeah, your concern is reasonable, Mr. Lincoln, because still now you are managing with your diet and medications, and suddenly if they are giving you an insulin injection, obviously you feel little bit difficult to go through that phase. But here I would like to tell you, Mr. Lincoln, that your last glucose report shows little bit higher glucose level. Because of that, doctor advised you to take insulin injection. Try not to worry about that. Take some period of time to insulin injections. Then after the next report, we will see how your recovery is. According to that, we will decide you that you have to stick on medication or the insulins. Are you following what I'm saying, Mr. Lincoln?
Yes, nurse, exactly. And
Yes.
nurse, can you tell me if there is any other way to manage my diabetes?
I'm sorry. What could you please repeat what you just said?
Is there any other possible option, any other way to manage my diabetes other than these insulin injections?
Mr. Lincoln, I'm afraid to tell you that because we have only two options, like we can manage with the tablets or we can manage with the insulins. In your case, you have already till now you have managed with the oral medications. Now your glucose level is little bit high. So according to us, you have to take insulin injections. Just try not to worry about it. I can understand this is overwhelming for you to go through the injections, because any layman person, they are not want to take injection every day. But don't worry about that. You will be all right, and gradually you will that you will understand the process and you will catch up with that process. So don't worry about that. Are you following what I'm saying, Mr. Lincoln?
Yes, nurse, absolutely. I understand. And I totally
Yes.
agree with you. If there is no other possible option, then you can explain me the procedure of taking the injections, nurse.
Thank you so much for responding and willing us with taking insulin injection, Mr. Lincoln. So I'm going to tell you that how to administer and how to use the insulin injection. Shall we proceed for that?
Yes, nurse, definitely.
Thank you for responding, Mr. Lincoln. So here, this is the injection. You can see in my hand that is a very tiny needle and it's a pencil size of the injection. And you can use this injection at the three places of your body. You can use that on your shoulder, or you can use that on your abdominal area, on your thigh. You have to take the medicine as per the doctor advice. Your doctor already gave you that doses of list, morning, evening, and night. According to that advice, you need to just take it. Like you have to withdraw that much, or 4 or 5 units of insulin, and just you keep that in your side, and just try just make sure that you are not using that side over and over again. Just make sure that every time when you are using, you just pick a different side. That will really helpful for your in your condition. Are you following what I'm saying, Mr.
Yes,
Lincoln?
nurse, I
Yes.
am following you. And regarding
Yes.
this, should I change the place of the injection site or should I take the
Yes.
injection in the same place every day?
Yes, yes, of course. You have to change each and every time if you are that because you are self-administrating. So abdominal area is a perfect place for you to administer the insulin injections. What you would just do, just try to avoid the novel area and take the insulin side of the your stomach. And whenever you are administering the insulin, just try to make sure that you are administering other places. Like if it's the right side, then next time you just use a right left side. That will really make you to prevent for a bruises, because it's a very tiny needle, but we it's better to take a precautions, Mr. Lincoln. All right.
Yes,
Okay.
yes, nurse,
Okay.
that's very clear. But
Okay.
how
Yeah.
is that possible? And I am not a professional nurse or an expert.
Yes.
And if anything goes wrong, if there are any side effects, what will I do then?
Yeah, I can understand that it's really horrified for you to use yourself injection. I can understand that, but you try not to worry about that, Mr. Lincoln, because it's a very small procedure. We will teach you, we will guide you for a 2 to 3 days, and after 2 to 3 days you will be all right. You can administer for yourselves, so don't worry about that. And now I will after this explanation, I will teach you that how you can administer that yourself. So don't worry about that. Am I clear to you?
Yes, of course, nurse. And then the next point is I want to ask you, what about the used syringes? Can I use them again or should I throw them off?
Yeah, that's a very good question, Mr. Lincoln, that I was about to talk about that the safe needle disposal, because after the use, that is a single use of needle. Whenever you are using that needle, you have to dispose in the this safe container. What I will give you, you have to just throw in that container, and after a 1 month, the pharmacy people will come with a new stock, and they will return this box, and they will take this box, and every 30 days you have to replace that. Are you following what I'm saying, Mr. Lincoln?
Yes, nurse, I am
Yes.
following.
Yes, so whenever you are using, make sure that you are disposing in this box, and try not to worry about that. You will be all right. Okay, Mr. Lincoln.
Yes, nurse. Is there anything that I should know other than this? Anything like
No,
brochures or leaflets or literature, if you have anything?
yes, yes. Thank you for asking that, Mr. Lincoln. That this is a leaflet. In that you can see that there is a where you can use administer the injection, plus the process of the insulin, how you can administer that, and what are the precaution you need to take. That all the details is available in this leaflet. So just try to read it out and just make sure that you are using this process perfectly. Am I clear to you, Mr. Lincoln?
Yes, nurse. Thank you very
Okay.
much. It
Thank you
was.
so much responding, Mr. Lincoln.
Have a nice day, nurse.
Thank you so much for talking to me. I hope for your speedy recovery, Mr. Lincoln. Thank you so much for talking to me.
Yes, that's the end of the speaking session, role play number 1. Now we have the second role play. This is the candidate card. All set. So you can prepare. And then when you're ready, you can hint me and you can start.
Okay, sir.
Right. Let me take my card here. Okay. Right. Yes, nurse. You can start when you're ready.
Yes.
Is the screen clear to you?
Yes, sir.
Okay. Go ahead.
Okay, sir.
Right. You can start.
Okay. Good evening.
Good evening, nurse.
My name is Simon Faith, and I'm one of the nurses in this hospital. I'm here to take a vital signs for your child. Shall I take it?
Nurse,
All right.
I believe that what is going on is not fair enough. I have
Oh,
been
I'm so
waiting here for the past 1 hour and nobody was there to support us. And now you come here and asking to take the vitals of the child. I'm really totally disappointed with your treatment.
Oh, I can see that you are very upset because we are delaying giving you, assessment for that. I'm really sorry about that.
Yes,
Because
ma'am.
of this,
How can I
yes.
not be upset? My child is suffering. She has been, struggling. And if you were in my place, you could have understood that situation.
Yes, definitely, I can understand. For the proceeding, may I ask your name, please?
My name is Margaret Thatcher, and you can call me Maggie.
Hello, Maggie. I can understand, really understand your concern, Maggie, that in this condition we cannot see our children to suffer. I really understand your concern, but because of the emergency case, doctor is not available, but he will come soon as possible. We already informed him, and he will arrive soon. So try not to worry about it. Just stay relaxed. I'm here to check the vital sign of your child, and he will be all right. Try not to worry about that. Okay, Maggie. Are you following what I'm
Actually,
saying, Maggie?
nurse,
Hmm.
she has multiple problems, I can tell you. She
Okay.
has chest tightness, wheezing,
Hmm.
and difficulty breathing. I'm
Okay.
extremely anxious and my fears are that she has asthma. Nurse, come on, check her please and confirm that she has asthma. I want you to tell it now, please, nurse.
Yeah. Yeah, I can understand your concern and worries that you want to know that what happened with your child. I definitely get it. But here, Maggie, the case is after the assessment, doctor will assess, and then after he will give the diagnosis. What is the proper diagnosis for your child? So at this present, we cannot tell you what is the cause of your child's this condition, why he is facing this chest tightness and wheezing, but we can start assessing. We will start treating for that, and after the assessment, doctor assessment, we can tell you that what is the cause of your child. Am I clear to you? I'm making sense to you, Maggie?
Yes, of course, nurse. That's
All right.
quite clear. But,
Yes.
my child's condition, I
Okay.
am not able to see and I feel very sad. And I'm
Yeah,
concerned
I can.
seriously that this is something very important. So,
Could you
nurse,
please?
why don't
Yes,
you
yes.
call the doctor immediately? What are you going to do with my daughter? Let the doctor come. Nah? He will see, he will give the treatment, he'll give suggestions.
Yeah, I can understand why you are feeling that much frustration, Maggie, because no one wants to wait in emergency department. I totally get it, but the thing is, because of one emergency case and the doctor they are assisting there, I already informed them they will come soon. The message is already conveyed them that one patient is there about your child, and they told me to check the vitals and start the assessment. What I will do till the doctor will come, I will take some information for your children's conditions, and that will really help to the doctor to get diagnosis as soon as possible. How's that sound? Is it okay?
Um, I'm not convinced, but if you think that, okay, I don't understand why you are not going to check my daughter and tell me that she is suffering from asthma. Please, I want to know that.
Yes, I because Maggie, I'm not the authorized person to tell you the what is the cause or a proper cause of the for your child condition, because we have to go to certain test, and we have to take some blood test, and what doctor advising, according to that we have to follow the advices, and we have to go through that procedures. Maggie, I can understand your worry, said that you want to know as soon as possible the what's wrong with your child, but the thing is after the doctor assessment we can tell you that what is the cause of your condition, what is the condition of your child. Am I making sense to you,
Yes, ma'am,
my
I
audio?
can understand.
Okay. Okay.
Okay, if there is nothing to do, okay, you're not getting the doctor and you're not telling me that my daughter has asthma. What else can I do? I'm helpless. Okay, do whatever you want.
Yes, I'm really sorry that you are, you're not satisfied with my answers. What I will do till the doctor will come, I just want to ask you that what about that incidents? What happened with your child when you were that make you to come emergency department? Could you please tell me about that?
Yes, nurse. Now I don't know what to do. I'm just waiting here and I don't know when the doctor will come. I'm not sure also. So that makes me, upset.
Yeah, I'm so sorry to hear about that, but just try not to worry about that. I'm continuously, he's in the hospital, and your child will gonna be all right. Nothing's gonna be go wrong because you are in the safe place. Doctor will arrive soon. Till now, let me check the vitals, and I will inform these vitals vitals. Then doctor will understand the seriousness of your child, and he will come as soon as possible. So please let me check the vitals. That will really helpful for your child,
Okay,
Maggie.
nurse. Carry on with your things. Thank you very much.
Thank you. Thank you so much. And the one more thing I would like to tell you that till the doctor come, I have to continue. I have to check. Continue. Have to check your children vital signs to know the your child conditions. So could you please give that permission?
Yes, nurse. Thank you. Go ahead. Go ahead.
Thank you so much. Thank you so much, Maggie, for giving cooperating with us. I can understand it's a very difficult time for you to, convince with us. But I'm sorry for that. But try not to worry about that. You are in the a safe hand. We will take care of you. I'm going to check your child's vital signs, and your children gonna be all right. So try to relax yourself. Stay with your child. I will be back soon. All right, Maggie.
Right. That's very nice. Thank you very much.
Thank you, sir.
So, amen, faith. So, were you a little bit stressed, or were you feeling that you were in the real test, or what were your feelings regarding this?
No, I don't know. I just became stressed. I became anxious. I'm not able to speak properly.
Okay. Okay. So, relax. If this is the case, then in the exam it will be the similar condition, right? It will be
Yes.
even more than that, right?
Yes, sir.
So no problem. Okay, I'll tell you the suggestions. I'll give you some points what you can do to overcome this feeling of stress and tension or worry and being upset. Okay, now coming to the point. Number one, you have some grammatical errors.
Okay,
like
sir.
you say, advices. There is nothing called advices. It's only advice.
Okay,
There is
sir.
no singular and plural because it is uncountable now. Advice, like furniture.
Yes.
Okay. Furniture, advice, a set of everything together is furniture. In the same way, lot of sentences together become advice. It's a conglomeration of suggestions. Okay, suggestions. I gave one suggestion, I gave two suggestions. But advice, no way. It's uncountable. So you cannot use the plural form of this. Advice, that's all. No a, no the, no an, no advices. But in the advice, that means that particular advice. This is not as countable, but the means particular. The advice which I gave you is very important. Follow it
Okay.
and you'll benefit. The advice means that particular advice is not considered as singular or plural. So remember that. Next, those you're using, and this you're using, and you're using plural. I don't recall that particular word here. So be careful when you're using this, it is singular, these plural. This is singular and these plural. What you are doing is you're using singular and saying the plural word. So like this, there are some mistakes. You have to overcome those areas and you have to be very confident. How you are going to be confident is, okay, just believe that the other person is nothing. He's just a patient and he doesn't know anything. He has come for your suggestions. He's going to ask you what he has to do with his condition. And you are the one who is very powerful and you can explain him everything. So in that way, you can benefit. So thinking that you are superior, don't think that you are doing a test. You're doing another counseling or interview with somebody, that's all. So you're talking to a patient and there is nothing, it's not a test at all. Patient is a normal human being and you are more powerful than the patient because you are professional and the information is passing on from you to the patient. So there is no question of any worry or tension or upset. So how you react to a particular patient in your clinic or ward or hospital or wherever it is. In the same way, here also you have to react. So once you react in the similar fashion, it will be easy for you. Then next, your pronunciation is fine as any other nationality's pronunciation. It's good. It cannot match with the native speaker's pronunciation, but that's okay. That's okay. They are not going to bother unless and until the clarity is not missing. The clarity is there. Everything is fine in its place. Then no need to worry about anything. That's the point. The next one, you can practice some more sessions like this. Okay. Practice some sessions with your friends. Okay. And then you can improve. You're doing fine. No problem regarding that. And the last point is you're repeating sentences. You're repeating phrases. You're repeating words. You're repeating the ideas. Repetition is a very big mistake.
A big because
For
of
example,
anxiety.
try not to worry. The video is there on the YouTube. It's okay. It's okay. It's okay. Finished is finished. We can understand that it was regarding anxiety or pressure or confusion or whatever panic it is. That's not a problem. But what I'm telling you is, if you overcome that, it will be perfect. But whatever it is, repetition is the problem. Avoid repetition. When you repeat a particular word, that means you are going to say the same style again. So there is no benefit with that. So never use the word a second time.
Okay, sir.
Change. So try not to worry. Instead of 3 times, there is nothing to be upset. Try not to worry in first instance. There is nothing to be upset in the second sentence. Oh, this is a common thing.
There is no.
Take it easy. It's not so difficult as you imagine. So 4 different ways I have told you. You can use alternatives. It's one and the same. So try to implement quality sentence structures rather than repeating. And avoid I, we, you as far as possible. You can use them. Avoid as far as possible. Because, for example, let us take one sentence. I have come to explain you regarding insulin injections. So I have come to explain you how to take insulin injections on a regular basis. So I have come to you to inform you about how you have to take these insulin injections on a regular basis. How many times you are using you or I or he or she or it? Avoid personal pronouns. Second one, avoid personal pronouns. So how can you avoid personal pronouns? By removing I and you. Insulin injections are the last option, without which managing diabetes is impossible. Where is I? Where is you? Where is he? Where is it? Managing diabetes is absolutely impossible without sugar, like this. And therefore, the better option is to commence this strategy, this method, this option as soon as possible. That's it. So this is the way how you are going to present your sentences. Everything is fine. There is no problem. That's okay. You are in safe position. There is no harm. But when you can score better, for example, 380 or 400, why do you want to settle for 350 or 360? That is my concern. You're safe. You're safe. But you can try better styles. Is that clear?
Yes, sir.
Anything you have to speak?
No, I'm just worried that today I did not perform well. So
It's okay, no problem,
today.
no problem. Suppose this is the same exam, okay?
Yeah.
This is the exam, then what are you going to do? So better prepare well. Tomorrow I'll give you one session, okay?
Okay, sir. That
Right?
will
Because
really help.
you are my student. You are my student.
Yeah.
You did not register for speaking, but still you are
Yes.
my student, okay? Because you
Yes,
have
sir.
registered for what's that, reading.
Reading.
So
Yes, sir.
I'm trying to bless you in a different way. That's all. Okay.
Okay, sir. Thank you, sir.
Right. How do you feel regarding the feedback which was given to you
Yeah,
in the
that's really
session?
helpful.
How was the session? Okay. Was it
Yeah.
useful for you or beneficial for you? And
Yes,
how
sir.
was the classical corrections channel and the sessions and the trainers helping you or
Very nice.
supporting you?
Yeah, yeah. Everyone is very good, sir.
Yeah. Tell me your feedback regarding the present session.
Yeah, it was like the thing is if I'm doing practicing with my friends, that is okay. I'm very freely I'm talking. But when I'm speaking, I felt like I'm speaking in front of examiner, and that make me feel anxious, and I did all ulta pulta. There is no you know so I understood, so I have to stay calm and do that, so that will really helpful.
Very good. Very good. Thank you. Have a nice day. We'll meet tomorrow.
Yeah, thank you, sir. Thank you for that.
Okay, dear.
Okay, sir.